Move straight to our focus for today. Of course, we have our guest already seated in the studio, the Deputy Head, Business Development and Client Relations, Ondo State Contributory Health Commission, Pharmacist Kolawole Oluwafemi. Glad to have you join us in the studio this morning, sir.
Yeah, good morning, presenter.
You're welcome.
It's my pleasure to be here.
Thank you very much. So we'll dive straight into our focus for today. So today we're looking at, Nigeria's health sector, the healthcare affordability, the pros and cons. That's what we're looking at today. So today we tackle a question that touches every home in Nigeria. Can the average Nigerian actually afford healthcare without going broke? From out-of-pocket payment to NHIS. I can see you have the oranges cap here in this. We'll see how we ask you questions on that. From private hospitals to public clinics, the cost of getting sick in Nigeria has become a crisis on its own. One emergency admission can wipe out a family's savings depending on the severity of the case of, that person. One prescription can mean choosing between drugs and food, and quite a lot. But it's not all bad news. States like Ondo State here have rolled out contributory health schemes, where you work. Private providers are innovating, and there is a conversation about universal health coverage. Now, the question is, are these systems working for the average market women, civil servants, and Okada rider, or are they just on paper? So we are just going to weigh the pros and cons of healthcare affordability in Nigeria. What's working, what's failing, and what must change so that getting sick does not mean going broke. So I hope at the end of this conversation, we'll be able to, find answers to all of these questions. So let's quickly ask you, out of pocket crisis, Pharmacist Kolawole, once again, thank you very much for accepting to talk to us.
Thank you for having me, presenter.
So it's not like a hot seat. We just want you to give us clarity,
right,
on this. Over 70% of Nigerians pay for healthcare out of pocket. Why is this still the case in 2026? And what does it do to families when one illness strikes?
Like you mentioned, a wealthy person is one major health condition away from being broke. Our acceptance of health insurance has been really not so welcoming, even though we continue to do so much at the level of Ondo State to the fact that people can get insured. Okay, so this is the crisis we have. When there is a health condition and there is no finances, the fear of, if I go to the hospital, I will have to pay for consultation, I will have to pay for drugs, I will have to pay for laboratory services, at times discourages people from going to the hospital. So a lot of them end up seeking traditional medicine that may not exactly attend to their health conditions. A lot of them do not even, they decide to self-manage at home, do self-medication at home, and this would do no benefit to their health. So that is why different health insurance agencies now exist in the country. At the level of the Ondo State, we have the Ondo State Contributory Health Commission that has come with different health insurance products to the end that people can get access to quality, because part of our conversation today goes beyond just affordability. There's no point for something being affordable, but it's not of good quality. And there's no point something being of high quality, the healthcare system being of high quality, but it's not affordable. So we are going to look at it side by side. So at the whole DCAC, we have different health insurance products that has been designed for different people in the community, in the state, resident of Ondo State, to the end that they can access quality healthcare at little or no cost. We have different, maybe we'll get to that. We have different health insurance products. There is the one for vulnerable pregnant women and children under 5. That one is, we call it Abiyamo scheme. That one is 100% funded by the Ondo State government. Of course, the entry point for that is the card Igbe, because we want to ensure that they are indeed.
Are you sure it's 100% free?
Funded, yes.
Okay.
Yes, but we'll of course, what we handle is maternal and child health.
Okay.
So the state government funds it. We want to be sure. I was saying that we want to be sure that people that are getting this health care are indeed residents of Ondo State. One of the things we learned from the ABA program from the past government is that we had people from other states come to enjoy these things, the program might be it. And so now we're trying to restrict it such that it's still of high quality. We do not overwhelm the human resource that we have, because another thing is one of the challenges facing the healthcare system in Nigeria, like you all know, brain drain. A lot of health professionals are leaving the country, so we want to ensure that people that are still in the country get to not become overwhelmed. Okay, so the Habiyamo scheme covers vulnerable pregnant women and vulnerable children under 5. There is also the basic healthcare provision program. We have codenamed it Ilera Loro to make it easy for people to relate with. Ilera Loro scheme. That scheme is for vulnerables generally. Now there is that one is co-funded by both the state government and the federal government. 1% CRF, Consolidated Revenue Fund. Recently it was increased to 2%, I think about last week. So is worth comes from the federal government. The state government also co-funds it to that end. So that one is for vulnerables generally. The Abiyamo is for vulnerable pregnant women and children. Now, the big one, oranges. The Orange Health Insurance Scheme. Now, it's divided into 2, because you mentioned that artisans, traders, how can they also access healthcare? So it's divided into 2. There is the formal sector scheme for civil servants in Ondo State and political office holders that are residing in Ondo State. Okay, so the premium is the amount of money you pay to get insured. Is percent of their salary. However, that percent is also subsidized by the state government. For civil servants, it's 3% of their gross salary, but 1.8% of that 3% is being paid for by the state government. So it means if your salary is 100,000 naira, for example, and your staff from those states, civil service, the premium is 3,000 naira per month. The state government pays 1,008, while you, the enrollees, pays 1,002. That is the premium for Orange Health Insurance Scheme, formal sector. Now, the informal sector, because we know that more of the population of residents of Ondo State are not civil servants. They are not political office holders. So how can we get across to them? So we launched the Orange Health Insurance Scheme for the informal sector's workforce in Ondo State in 2024, September 9, 2024, by our Governor Lucky Orimisoye. That's why we launched that in 2024. So how does that work? We don't have access to their salaries, remember. So how are we going to make it affordable for them? Because one of the things we're looking at is, even if you give a premium, can people afford to pay this premium? So we brought it to 18,000. Now there are different plans. There is the individual plan. Individual plan is as low as 18,000 naira per year. If you bring down 18,000 naira to a day, that's about 50 naira per day. 18,000 naira divided by 365, less than 50 naira per day. For people that are not up to 60 years. If you're 60 years and above, you pay 36,000 naira. That's about 100 naira per day. That's for the individual plan. Now, family plan, you have a family. We went ahead to even subsidize that. The ideal family, according to the NHI standard, is a family of 6, a man, a spouse, and 4 biological children. So that plan that covers family is for 90,000 naira for a year. 90,000 naira divided by 18,000 times 6 ideally should give 108. Yeah, 108,000. But we still discounted it, so it's as though we are giving you a last enrollee for free. So 90,000 naira per year, and you get access. And the family plan allows you to onboard to have access to maternity services. So you want to give birth. If you want to give birth in Ondo State and you're paying out of pocket, like we're talking about the other time, you would pay nothing less than 300, 250,000 naira for that service alone. And we're saying beyond childbirth, if you're doing CS, that is the figure. If you're doing CS,
I wanted to ask you that.
If it is just
normal
SVD,
delivery,
no, it's not likely you pay up to that. So, but you might still pay up more than 90,000, even if it is SVD. I mean, what you refer to as normal delivery, you might still pay up to 90,000. So, those are the 2 plans. And of course, there's also the group and association plan, because we're trying to get as many people as possible. We can't do so much by, of course, we can do by, if we are trying to get individuals. So, we're trying to say, okay, can we get associations? Can we get churches? Can we get community members to key into the scheme? So, depending on the numbers they are bringing, we are looking at giving them discounts.
Okay.
Depending on the numbers. We have been to churches, we've been to...
If the numbers are large, they get a discount. But if it's not large, they will pay for it.
They will pay the normal 18,000, 36,000 or 90,000 naira that I mentioned earlier.
All right, Mr. Kolawole, let's look at basically the health system this year alone, 2026, is actually shifting towards, one plan, one budget, one health sector, and the basically the approach, to avoid duplication of effort with very strong support from WHO, UNICEF, and Clinton Health Access, and others that you have mentioned. Yeah. But let's look at, some of the challenges and focus on those areas. Let's look at rural access, because, for example, despite the initiative, there are challenges, in providing quality healthcare in remote areas and even the outskirts of Akure, apart from going to other places, and also the prevalence of the disease. For example, malaria, tuberculosis, HIV, alongside rising cases of hypertension and diabetes, continue to place a big burden on our esteemed health workers, because without, your sector, I wouldn't know where anybody would be. We saw your effort in the recent alarm, that we saw about what's this disease now? One was seen in the southern part of Nigeria. It was just one case, seen there.
Is it the Ebola or the recent one? Is it antivirus?
No, before Anta, there was one that we have had before that the likes of Adedevo, sacrificed themselves to stop.
Okay.
Lassa fever.
No, it's not Lassa. We definitely
Ebola?
remember. I think it's Ebola, right?
Ebola.
I think it's Ebola.
Yes,
There was one
Ebola.
case in the south, and quickly all other states were, on red alert to just stop it. So I hope my questions are not much. Let's look at the challenges, rural, and also the prevalence of the diseases that we have.
Yeah, one of the major challenges bedeviling the healthcare system in Nigeria is access. Because our road network, and that in itself will now reduce the health care force, the workforce. Because when the road network to the remote areas is not there, when staffs are deployed to those facilities in the rural areas, there's a tendency for them not to want to go or not to want to stay. So, of course, there are efforts by the state government to ensure that ideally people that are residents in that environment are recruited. Okay. They are more likely to stay.
Proximity factor.
Yes, they are more likely to stay. So those are things that are... So, of course, the state government is trying to ensure that road networks improve and the federal government road networks improve, but it has been a major challenge, access. However, a lot of effort is going into primary health care now, because those are the levels of health care that can get into those areas. And if there is a need for them to refer, provisions are being made by the state. Recently, I think about 2-3 months ago, there were vehicles that were given out by the state governments to ensure that there can be ease of transportation from these primary health centers in these remote areas for cases that are beyond them, secondary and tertiary cases, to the facilities, secondary and tertiary facilities that can attend to them in the more urban areas. So these primary health care, primary health centers are there is no way we can talk about universal health coverage in Nigeria without talking about primary health care. That's the backbone.
It's like the basic.
Yes, they are the ones that move into the communities. They are closer to our people. So and the government is doing a lot of things towards that, and also development partners are doing also working towards primary health care. So these challenges are there, but we continue to work around them. We continue to surmount the challenges, look for strategies to overcome them.
All right. Thank you very much, Pharmacist Kolawole. Let me ask you this. Quite a number of persons have come out to say that public hospitals are cheap, but not really getting the quality health care that they need, while private hospitals are good but unaffordable. Is that a fair assessment? What's the middle ground?
Yeah, a lot of these things are, like you said, a lot of people sees is hearsay. I'm not saying there are no challenges with the public facilities. At the level of the ODCSC, we have both government owned and private facilities so that you can make your choice. But it will interest you to know that there are certain cases that these private facilities still end up referring to the government facilities. So, yeah, I don't exactly agree with you that it's a fair assessment of saying the quality here, the price is cheap, but the quality is not there. The Ministry of Health have a lot of monitoring teams that visit at the level of the ODCs too. I can say so much at our own level. We do what is called QHI, quality improvement. After initially accrediting these facilities, I mean the government-owned facilities, because you will not talk about the private ones. The government-owned facilities, we still go there on a quarterly basis to be sure that, do you still have the human resource you had when we accredited you? Do you still have the infrastructures you had when we accredited you? Just to keep them on their toes. And we design structures. We have a 24/7 contact center numbers, I'm sure you're aware, that enrollees can reach us in case they have challenges at these facilities.
We will need that number much later in our
towards the end
discussion,
of the
you know,
program.
because just like she said, I know that you might have some things on ground, but how effective because I wanted to give you an example, but I won't mention the name of the facility, you know, in Akure Metropolis. It's actually a primary healthcare facility where, you know, some things were done, and maybe the persons concerned were not satisfied, you know, and of course they were left hanging, not knowing who to contact. And in fact, they had fears that if they approach and if they go to the general hospital and go and complain that something just happened here, they won't let them enter, or maybe, you know, that will cast the whole matter and they will let somebody lose their job. You know, there is this, you know, emotional take that we go to, we think, but there's a bottom line I want to draw. Personally, I discovered that some of these facilities, maybe their staff do not resume early. For example, I was able to confirm that maybe sometimes a nurse or some nurses will come by 12. I know sometimes you run shifts, just like, you know, the media job. We are equally essential workers. You come when it is your duty. But sometimes people who it's their duty to be at work in the morning, sometimes I find their way, you know, to the facility around mid-morning, because, okay, we don't have patient like that. You know, before I left last night, it was just, you know, regular, whatever. So what do you have on ground to monitor the activities of these people so that those going to the facility would have a clear mind that, they won't neglect me here if I go there?
Yeah. So, the level of the Ondo State Contributors Commission, I told you I can say much about us.
Okay.
We have what we call third-party administrators. Other health insurance agencies call them HMOs, but we call them TPA, third-party administrators. They are intermediaries between us and the facility. Their job is to quickly respond to challenges at the facility that our enrollees face at the facility and get across to us if they can't resolve it on their own. We have 3. We have LifeWorth, we have United Healthcare, and HMS covering different central districts of Ondo State. So these are first responders. We pay them, of course, we pay them for that. Then we have a 24/7 contact center number. I'm going to call out the numbers now. For our oranges enrollees. 0201
0201
700
700
4601.
01. Let's take it again.
0201
0201
700
700
4601.
01.
That's number 1. The second number is the same number but ends with a 2.
Okay, let's go.
So 0201
0201
700
700
4602.
02.
So that's
it's a toll free, right?
Yeah. No. It's not all free.
Okay. They will just charge them fairly.
They will charge you fairly. But our contact center agents respond quickly, so you don't get to spend so much time waiting. You know, so we have a lot of.
I have an emergency.
Yes.
I want you to also clarify to our listener at home, those who are entitled to oranges, the classes of persons who could enjoy, you know, the treatment from oranges. I want you to let people know at home.
Okay, so if you are a civil servant in Ondo State, employed by the Ondo State government, either you work in TESCOM, SUBEB, different work groups, TESCOM, SUBEB, local government, Ondo State Internal Revenue Service, and core civil servants, whichever one you fall into, automatically your premium is being deducted every month. 3% of your salaries. Again, I explained earlier that part of it is paid by the state government. So that is being deducted. So you have access to a non-co-payment method of health insurance. I said non-co-payment in the sense that, unlike other forms of health insurance, that the enrollees pay a certain amount. For example, the NHIA. Enrollees pay 10% of the cost of their medications.
Okay.
So, for example, under that scheme, if the cost of your medications is 10,000, you pay 1,000 naira, and NHI covers for the remaining 9,000. But in oranges, you do not pay a dime after the initial premium that's been deducted from your salary. So you have access to quality healthcare at no cost. Of course, if we are to go into the...
Are they aware of this, all of them?
Yes.
Because some people might still really have access to these or have this advantage and not use them. And whoever is working in the civil service has one or two persons attached to them. Is it like 4?
Yes. So the civil servant scheme, that is the oranges formal sector scheme, is like the family plan scheme of the informal sector.
Okay.
So you have access to one spouse and up to 4 biological children.
You and your wife, then 4 of your children
that are less than 18 years.
Okay. If they're up to 18, you cannot attend to them.
You can. We believe that people that are 18 and above should be in tertiary institutions.
Okay.
So at the ODC,
so they are grown-ups.
Yes. No. Of course, they are grown-up, but they need to also access health care. We have a scheme for them. We at the ODCSC we have what we call tertiary institution social health insurance program.
Okay.
Designed for students of tertiary institutions. Already, one of our tertiary institutions in Ondo State has keyed in into this scheme, and their students get to access care in one of our facilities at no cost. Of course, the institution paid premiums for them.
Okay.
So we believe that once your children are above 18 years, they should be in one of the tertiary institutions that they will also be able to access healthcare on that issue. So they don't get double insurance coverage.
All right.
So yeah.
Okay, thank you very much. You did mention NHIA. I want you to reiterate this because 80% of Nigerians, based on research, work in the informal sector. So how do you capture market women, artisans and Okada riders who don't have monthly salaries? I want you to be very specific. You've just specified or ruled out that of oranges, the premium from their salaries. And I want you to also, be specific about this one too, because people are listening.
So for the informal sector scheme in Ondo State, under the ODCSC, we categorize both the informal sector, that is artisans, traders, Okada riders and all of that. We categorize them alongside those in the organized private sector.
Okay.
Basically, people that we don't have access to their salaries. So those are the ones that we designed the informal sector scheme for.
Okay.
So the informal sector scheme were the ones I mentioned earlier with the different individual plan, family plan, and group plans. 18,000 naira for individual, 18 or 36 depending on their age. For family, 90,000 naira, and for groups or association, discounted rates depending on the number. Such that they're able to access quality health care. At least, imagine paying 18,000 naira to access in a month. If one has malaria in Ondo State and you want to pay for drug,
you want to buy drugs,
or you want to buy drugs out of pocket. I don't want to mention brands now. If you buy certain anti-malaria drugs, one pack of one anti-malaria drug at times could be for 4K. So imagine, 4,000 naira. So imagine you're down with malaria, your wife is down with malaria, 2 of your children are down with malaria. 4,000 times 4.
You mean they will spend more?
Yes, you will spend more than the 18,000. That's 16,000. And we're saying pay 18,000 for 1 year.
Just 1 year?
Yes.
12 months.
12 calendar months, and then you get to access quality healthcare beyond the malaria. Because you might be hypertensive also, you might be diabetic.
But it does not cover surgery.
Exactly. Does it cover surgeries?
It does.
It covers surgery?
Because I have heard stories. I anchor a health program on the station, and we've heard callers have come out to tell us that they would say it covers everything. There's some particular stages, like for apologies, cancer, maybe stages you can, they say that particular caller said they can help at least at some point for probably
Basic.
the first basic thing, but the main thing that they do it themselves, and it's contradictory with what you are saying. I want you to clarify
What stage
that.
of surgery is covered under the scheme?
So I have not said Oranges covers all health services.
Okay.
I've only said it covers surgeries, and I've not also said it covers all surgeries.
Okay.
No health
Pharm
insurance.
Kolawole, he's trying to work around it, but no problem.
No, we have a benefit package actually. The
Okay.
benefit package is a document that defines all our covered services. It's a public document. It's accessible on our website www.odcac.on.gov.
Please let's take that again.
www.odcac.on.gov.ng.
So that is www.odcac.on.gov.ng.
ODCHC, not CA.
Okay.
CHC.
Okay.
That is Ondo State Contributory Health Commission. So if you go to that website, you will be able to download our documents. You will see the benefit package. The benefit package is like an 8-page document, 8 or 9-page document that contains all the covered services. So you will see the services that are covered. Anatomy covered, eniography you will see the services that are covered.
You can cross check.
Yes. However, I need to state that under the informal sector scheme, there is a 6-month waiting period on all covered surgeries.
Okay.
Because our people are very intelligent people. For example, you have been told that you want to give birth and they've told you you have to do cesarean section. So you now think, okay, I can pay 90,000 naira and access cesarean section. And if I want to pay out of pocket, I'll pay 350k. Let me quickly buy insurance and so it doesn't work that way. That is not insurance. The idea of insurance is everybody, 100 of us, come together. We put money together in a pool that in case one person falls sick,
Contributory.
that is the idea of contributory. The person will take out of the money. It's very likely that the person takes more than the 18,000 naira that the person dropped. The idea is not all of us will fall sick at the same time.
Yes.
But when everybody that falls sick are the only ones coming, who is going to pay for it? The idea, when we say insurance, the money is being taken from the pool because the government, to be fair with you, healthcare financing is the aspect that has come to help with sustaining healthcare financing because the government alone cannot fund healthcare. All over the world, don't say that even in the UK, if you don't. It's
So that's why
compulsory.
government is trying to subsidize health.
Yes,
healthcare.
they are doing so much. I told you of the schemes they sponsor 100%. They are helping there, but they can't do everything. So we have to
Even in the 100%. Is that what you're saying?
No, they do everything with the 100%. That is
Okay.
the BACP scheme, Ilera Loro, and the Abiyamo. They do 100%. But what about the vast majority of the population? Vulnerable people are not up to 5% of the population. What about the other population? How will they access quality healthcare? That is where
Those active who work almost every day, who
yes.
can easily get tired and are susceptible to some diseases and have to go to the nearest place, just get treated and get back home so that they
Yes.
can go back to work.
yes, because like I'm not sure I've said it here. When we are taking care of people's health, we are actually helping productivity. It is only a healthy person that can go to work. If you were not, I think she mentioned it. If you were not healthy, you will not be here running this program this morning.
Of course.
So when we are taking care of people's health, we are helping the country's productivity, the GDP of the country.
All right, let's look at. Let's look at this particular one, and of course, I'd like us to make reference to it. Let's look at the state of the facility in Ondo State. We have seen, government, increase funding, investment. Federal government also increasing its health budget by roughly 60% last year in the appropriation bill compared to this year, and like over $2.2 billion has been secured via the Nigerian health sector renewal investment initiative. Let's look at the state of the facility cut across that we have. Are you sure they are not dilapidated? And because if you are being treated at a place that is not conducive, the malaria won't go very fast.
To be fair, we need to do more on the state of our health facilities. We are helping at the whole DCSC. I'll tell you how we are helping, because some of our facilities that are government owned, they are not in optimum state. But we've come up with certain interventions to help them, because the ODCAC is established to also help health financing in those states. So what
do you have enough to go around?
Yes. What we do is there's a program we call the Hospital Intervention Program. Out of how do I explain? Because if I don't explain how that we pay, there are two forms of payments we make in our health insurance scheme. There's something called capitation payment. So capitation payment is a prepayment. Either you go to the hospital or not to access health care, there's an amount of money we pay for every of our enrollee every month. And I make bold to say that we do not owe a facility a dime.
Seriously?
Since 2022 that we started Orange's formal sector. We do not owe a facility a dime. What we do is we pay ahead. So typically, capitation list. So capitation list is the list of all the enrollees that chose a particular facility.
Okay.
So capitation list for June, we start working on it 12th of May. So that by the end of the month, before the end of
half of the month.
Yes, before the end of the month, we will make the payments to the facility, such that the facility can prepare ahead of your coming in case you come. It doesn't mean because you now know that, okay, they pay for me every month. Let me guys my money. That's moral hazard. That's one of the challenges non-co-payment method of health insurance face.
Okay.
People just go there. I know some people that go to the hospital every month. One enrollee reached out to me on WhatsApp.
I want to use my money.
Thank you. One you owe me. That is the phrase. One you owe me. So it says, my children are going to school next week. I want to take them to the hospital for them to treat malaria. Are they down with malaria? No. But just because they are going to the hospital, you want to? No, that's not how it works.
Maybe they were trying to follow you doctors, line that prevention is better than cure.
Prevention. When you want to prevent malaria, what do? You use ITN, insecticide treated nets, and now it's being distributed free of charge. I think there was a program.
Yeah, we went across.
So you take care of stagnant water in your environment. You ensure there are no stagnant water that mosquito can breed. On. Those are the things to do. And if there are actually preventive drugs for malaria that you use. But
they are saying people should not abuse the scheme available.
That's what we call moral hazard, because you now know that they pay for you. You go there to access health care. Orange's health insurance deals with people that need health care, not people that want. Another thing we face is enrollees go to the hospital and they say, doctor, give me so and so drug. You do not need it. So why? Just because you feel it's like my director general, Dr. Abiodun Oyene, the DG of the CSC, cite an example. He said he's been paying for car insurance for 20 years, for over 20 years. He has never gone to make claims for it once because there has been no need. He has not had an accident. So do you pray that you should go to the hospital because they deduct your money? My facility, I won't mention the name so that you don't feel like I'm recommending one over other. But it's a government facility, by the way. I use a government facility myself. When my wife was delivered of a child recently, it was the facility she was delivered on, and we didn't have so much issues. So when you were saying that quality, about government facilities, I experienced it myself. One of the
maybe one you want to say one of the best, because of course we have some that are better than the other, depending on the facility and the healthcare delivery. Because we've had instances, if I write in my presence, I've been to, I don't use government facility, I use private, but it is because of the attitude, of some workers, of some of the officials. You go there and then you pay, you're supposed to pay, and they feel maybe it's being subsidized, and they'll tell you they're supposed to give you, okay, for instance, let's just say you have a malaria, and then you go, malaria drug is finished, you have to pay, go to the cashier and buy in the pharmacy right there at the hospital. All of these things. And then I've seen people also come with a card, Abiyamo scheme, and the other ones,
they belong to the scheme already.
And then they will tell you, if you are if you have one, your card, if you want to pay with money. I'm telling you reality. I mean, I experienced it firsthand. If you are coming to pay cash, stay this way. If you have so those who came with cash, they attended to them first before attending to those who brought their cards. So all of these things what are you doing to curb all of this? To ensure that we don't have issues like, maybe I can actually have a rethink, of now start using the government facility.
See, I'm not coming to say that we have gotten it 100% right in Ondo State health insurance. It will take a while for our people to come to terms with health insurance. So, commonsensically, if you have an enrollee that you are not sure the enrollee will be able to pay completely for the cost of healthcare, and you have another enrollee that you are 100% sure that the agency will pay you, either they have prepaid or they will postpay eventually. You are 100% sure that they will eventually pay you. Who should you attend to first? Because this other enrollee that wants to pay out of pocket, the initial cost of healthcare. I know someone that went to a facility recently, a private facility, was in the night, and the person was going to, I will not say the case. So the initial deposit was 300,000 naira.
Wow.
I am saying that confidently. In the facility, in the private facility in Ondo State was they just said go and pay 300,000 naira. So if they pay the 300,000, that 300,000 naira will not cover the entire cost of the treatment. Are you sure they will pay the rest? And you have one other enrollee that is certain that the health insurance agency that has no history of owing you debt,
and it's binding on them to meet up,
to pay. So why should they not be the ones that you should attend to first? So these are issues. So I'm not saying we have gotten it right, and that's why we have all this. Very soon we are going to come up with the monitoring team, especially for oranges.
Please, not just team. Let there be a monitoring spirit.
And they should be stationed there. I don't think you should do it. You said quarterly the other time. I think you should do it weekly now.
Comfort, or they should come
even daily.
Comfort, or they should come like invigilators. That they are not announced.
Yes, that's what we plan to do. Yes,
they just come, because if you are there, they will be compromised.
Yes. So we will go unannounced to the facilities, and whoever it's just for us to, the monitoring team will comprise the Commissioner of Health, labor union leaders, and you know how strict these people can be. So we'll go to the facility unannounced, and once we catch anybody not doing the right thing, would penalize the person. So once we use certain people as deterrent, other people will sit up.
All right. Before we wrap up, looking at the prevalence of diseases that you're treating in Ondo State and what we have seen over the years, from hypertension to diabetes and others, I'd like us to look at another one, the sight problem. Most aged persons do not see. What is it that is free for them, especially cataract operation? Is the government putting that in place for people generally, or there is an amount they have to pay to benefit from that? And are they pretty convinced that it's going to be successful? Because some people, out of fear, they will say, make a kuku no see than make them go touch my hand and I will go see again.
Recently, the Ondo State government, there's a festival of surgery going on in Ondo State, where they are running surgeries in some facilities in Ondo State. That's one. But under the Orange Health Insurance Scheme, lenses are covered, but there is a peg. It's covered to a maximum of 10,000 naira.
Okay.
So it means if the cost of the frames are not covered, it should be clear. So you come with your frame or you purchase your frame. So if the cost of your lens is 15,000 naira under oranges, we will pay 10,000 naira.
You add 5,000
naira.
How about surgery for cataract?
Surgeries are covered, especially for civil servants. So civil servants, we have our job is to ensure that I didn't say that earlier. The mandate of the ODCSC is to ensure that all residents of Ondo State have a form of health insurance cover over them, and the idea is they get to access quality health care without going into what we call catastrophic health spending, borrowing money to access health care. You pay for health care, but you are not able to access basic needs of life. That is what we call catastrophic health care spending that will push you below the poverty line. So that is the mandate of the ODCSC, and that is why we have come. So if you look at the different schemes I have mentioned so far, there is no resident of Ondo State that does not fall into one category. It's either you're a civil servant, or you are an artisan, or you are a vulnerable pregnant woman, or you are a vulnerable a widow. The sickle cell warrior fall into this category of vulnerables.
Okay.
At the ODCAC, if you have them, please let them come. Sickle cell warriors, people that are sickle cell
survivors.
Yes, they should come. We pay for them. We enroll them. They should have NIN anyways. That's the basic requirement. If they do not have it, because the people that are giving us the money, they want to be sure that indeed we are attending to Nigerians. So they should have NIN. We enroll them in one of the primary health facilities. Primary health facilities might not be able to handle their care. So they will then refer to a secondary facility where they can be attended to at no cost.
Wow. All right, thank you, pharmacist Kolawole. Quite a number of questions for you today. I want to ask you, about the brain drain. You mentioned it earlier, and I want us to dive into it. Doctors and pharmacists like you are leaving Nigeria on a daily basis. How does JAPA affect affordability and access for those left behind? And I want to add this to it, another question. Should government partner more, with private hospitals to expand access, or what are the risks of privatizing healthcare? I just want you to answer this.
JAPA. Unfortunately, since time immemorial, people have rights to choose to whether to stay, right of freedom, right to choose to migrate, so we can't really stop them. But what can we do? How can we be strategic enough to retain them? Can we incentivize their staying? Can we increase their salaries? What can we do to the end that these people are encouraged to stay? So at the level of the Ondo State, the entry point for Ondo State medical doctors is grade level 13.
Okay.
Recently increased from 12, not so recent, about 2 years ago. Recently increased from 12 to 13. So all these things are done to ensure that these people are encouraged to stay. But there is so much we can do. We can't force them, but we can give them incentives. When they are being posted to the rural areas, we can give them rural allowances. I mean, these are strategies that we can use to encourage them to stay. Because if they are not many, I mean, if you don't have so many medical doctors and health workers to attend to people, it will overwhelm the system. A doctor, there's an idea, I'm not sure I can remember the ratio now. There's a particular patients to doctor, the number of patients that a doctor should see in a day. If you go beyond that limit, the doctor is fatigued, the doctor is stressed, and your waiting time at the facility will be increased. You start hearing things like, hey, I've been here since morning, no doctor to attend. It's because there are not so many doctors on ground, and that is why at the ODCSC we have accredited both government-owned and private facilities, so that in case, and of course in cases also where there are industrial actions, that government-owned facilities are on strike, they can go to private facilities to access healthcare. Privatizing healthcare, it's something to sit down and have a conference about. It's not something that can be done at the periphery. Let's look at the pros and cons. There are some agencies that have been privatized in Nigeria. You and I know, Power Holding Company. Has it increased? Has it improved? You have the answer to that. So something we should sit down and discuss.
Well, still on that, you said earlier, I mean, as of early 2026, the doctor to patient ratio in Nigeria is approximately 1 doctor to 5,000 to 10,000 patients. And it shows that there is a very big problem there. The gap is wide. But let me ask, is there, I mean, are there means of LD succession plan? For example, those who have gone to school to study and are hoping to, understudy with core professionals who are still on ground, that the medical facility or the state might feel like, if this person gets an advantage, they will leave this place. So then you now get somebody attached to them who can understudy what they are doing. I use the word LD, so that it won't be as if you are asking a younger officer to compete with, a specialist. Is there a very nice workflow, there?
See, should I be sincere?
We want you to be sincere.
An average, recently, Norgay, very enough local government employees.
Private hospitals are taking your men and women.
Yes. Norgay is going on a tour around local governments to sensitize their members, to discuss with their members. So the ODCAT team were following them. So on one of those visits, I think at Owo, I met with somebody who said his child is presently studying medicine and surgery in the university, and even he does not pray the child works in a government-owned facility.
Wow.
After, so he already has plans to jackpot the child.
Diversion plan.
Yeah, as soon as the child, finishes from medical school. So these are challenges that we have. But there are concepts that have been introduced recently. There's something we call task sharing and task shifting in healthcare. These days, you would have to teach. Task shifting is when you teach people, lower healthcare workers,
Lower cadre.
lower cadre, the roles of upper cadre healthcare workers, so that they can be able to effectively do it. But initially, they will do it under monitoring
Of the specialists.
yes, of the specialist. That is the way to go. And that is why you'll find out in some primary health facilities that the whole IC there might not be a medical doctor, might be a nurse, might be a community health extension worker. But they have been taught, they have been trained on how to do some of this basic primary care. That is the way to go, because the healthcare system, in all honesty, there's brain drain. People are jackpotting, quote and unquote. What do we do? How do we ensure that our people still get quality healthcare? Those are the approaches that we're doing: task shifting, task sharing.
All right, thank you, pharmacist Kolawole. You're a pharmacist. Why do drug prices keep rising, even with NAFDAC and government oversight? What can be done about the cost of essential medicines?
See, most of the raw materials for producing medications are imported. So, but when there is high levy, tax rate, import duty levy being levied against the companies that are manufacturing these drugs, there's a tendency for it to have an effect on the price of the eventual commodity. So, what can we do? The government should encourage local production of drugs, local manufacturing of drugs, or maybe not manufacturing, the raw materials for the manufacturing. They should incentivize these people. There can be interest-free loans that can be given to these manufacturing companies. I was at Drug Feed sometimes, my final year in the university. Drug Feed is one of Nigeria's foremost manufacturing company in North Ogun State. I was there, and at the time, they said they spent 30 million naira on power monthly. So I'm saying 2015, 2016.
Just on power?
Yeah, on power.
Not on the first 3 or 4 things needed to produce a drug.
Just power. So if we can get it right with our power supply, that's another incentive. Infrastructure, road network, cost of fuel. These companies will also transport their drugs, the goods from the industry, from where it is manufactured, to the market. The cost of my transportation will also fuel, 1,300 about. So if these things can be gotten right, it will drastically tell on the cost, the eventual cost price of the medications. So these are things that can be done. Incentivize them, encourage local production of drugs.
All right. How do we break free from auxiliary personnel, taking the job of core professionals? And when do they come closer to you just to learn a bit of the job? And how is certification? Let
me start from certification. There are agencies, there are establishments that have started with the responsibility of certifying different health professionals. The pharmacists, there is PCN, Pharmacist Council of Nigeria, medicine, there's MDCAN. So we have different agencies that ensure that people that have been well trained are the ones that are indeed called these professionals. I mentioned the concept the other time: tax sharing, tax shifting. You should not be, there is no fear of somebody taking over my role. The healthcare system is weakened, in terms of human resource, and we're trying to help it. So there should be no fear of somebody else taking over my job as a pharmacist. For example, a pharmacy technician taking over my job as a pharmacist. I have no fear, because I have depth. There are some things that
the roles are defined already.
They are defined, and they are working under my supervision. So there are some things. There are ways I will counsel you that no patent medicine dealer, no pharmacy technician can counsel you. That is certain. There are surgeries that no other person in the healthcare team, apart from
we're able to support a doctor.
No orthopedic. No, who wants to go into orthopedic surgery? Surgeries on bones, who wants to do it? So there's specialization that there is no fear. Your onions, there is really no fear. But the fact that that the healthcare system is weakened, we have not so many people. So what can we do? We have to do tax sharing, tax shifting.
All right, thank you very much, pharmacist Kolawole. I have this question for you. If you have the power, or if you had the power, had it before now, or have it, let's say, now, or tomorrow, to change two things about Nigeria's health sector or Nigeria's health financing today, what would they be? That's one. Then two, you talked about things to do to ensure that we don't have a lot of brain drain, Jaguar syndrome, and all that. I'm putting this to you, and that's going to be the last question from my end. If you're given a free ticket or visa to migrate for greener pastures, even as a pharmacist doing well in Ondo, would you go or not? I want you to be very honest. Nigerians are listening.
Let me start with the first one.
Yes.
What are the two things I would do? I would make health insurance compulsory, mandatory for all Nigerians, because no government can fund healthcare alone. The second one is closely linked to it. I will ensure more political will in health policies in Nigeria. There is something we call policy somersault. I'm not going to say so that I don't. If this government comes into power, this government comes up with different programs on health. Government B comes after 4 or 8 years and has an entirely different direction, and then
holds the previous and start a new thing.
So there's no continuity. So, but if there is a government that is willing to, stay with these things, look at it. What are the pros and cons of starting a new program over improving on the former programs? Yes. So go ahead with it. So those are the two things that I would do if I had the power. So the other question is on if I had a free ticket
and visa.
My director general, used to say something. Anytime somebody comes to him to say, so I'm considering this option, I want to jackpot this and this, he will say, if you are really doing well here, jackpot will call you. You are not the one that will go and jackpot. They would, because they see your value, they would call
for you
to come and help them solve a problem there. So I'm not desperate to jackpot. I'm desperate to add value. So if I'm adding value, jackpot, if I need to jackpot, it will be on the platter of good.
I want to say, what stage will it get you?
So you are saying that
you decide to move?
They are giving you, they are calling you abroad now, you're doing well here. And say, pharmacist Kolawole, we know you're doing well and all that. We're giving you a free ticket visa to come to our country and not return to your home country again because we know you are good. We just want to, and we'll give you everything that you need.
Come and practice here.
That clause, I was already considering the offer until you said, I'm not return to nobody can take me away from here. We are Nigeria, we stay here.
You mean if you're going to go, it's going to be at will, not because you are being,
you can go there, learn on how to make your own health system better. Most of the scholarships we used to have those days, Commonwealth, those scholarships those days, they will tell you there is a contract that you must come back to improve your country. So that is the intention. So once you go there, have it at the back of your mind that there is a plan to use that knowledge to come and help your health system, because you can't be there forever.
You mean it defeats the essence of going to learn without coming back to practice?
Yes. What's the intention?
So
going there to help their people. You learn, help them at the interim, at the short term, but over time, come back and help your people.
All right.
Your family members are here. Your father, your mother are here.
All right.
Your children are, maybe your children, your nephews and nieces are here.
All right.
So that's intention.
So, Pharm Kolawole, what would you advise a regular Nigerian listening to us today? Sum up what we have discussed. 2-3 things you are going to advise them about their health.
If you do not have a form of health insurance in this day and age, you are wrong. For as little as 18,000 naira, you can have per year. You can have access to quality healthcare without paying any additional fee. Get insured today. Reach out to us. I've given out our phone numbers. You can also come into our office inside the Ondo State Ministry of Health complex beside Governor's office. The name is Ondo State Contributory Commission. Come there. We'll explain to you the options you have. That's the first thing. The second thing is preventive health is the way to go. Check your blood pressure regularly. Eat good food. Consume less of processed foods, bread, indomie, noodles, and those things. consume less of those
noodles and pasta and all.
Yeah, consume less of them. Live healthy, exercise, sleep well, rest well. Now who make money? 9 days. Now who they alive? 9 days spend money. So yeah, those are my basic concerns.
All right. Just in case you'd like to join the conversation fairly before we leave, you can call studio lines. They are open 0805 551 1110
or call 0706677182. Those are the two lines to call to be part of the conversation. In case you have questions for pharmacist Kolawole Oluwafemi this morning, you may also drop your comment on the live streaming session on Facebook at Glow 99.1 FM Akure. While we're waiting the call, let's see if we have some comment on our Facebook page. Do we have comment from our Facebook page at the moment? If we do not have, we're about to sign off, say bye-bye on the program this morning. Of course, thank you very
Charles Lowanga, I guess you wrote in their own language, you said perfect team. Thank you very much, Charles Lowanga, for dropping that comment there. You can always leave us comments on Facebook. Even after the show, we'll definitely take it in and read.
All right, that's how much we can take on today's edition of Glow Focus, your mid-morning conversation of the nation. Would like to say a very big thank you to our guests, though the time was short, and of course they accepted to come to the studio. Deputy Head, Business Development and Client Relations, Ondo State Contributory Health Commission, Pharmacist Kolawole Oluwafemi. Thank you very much for coming on the program this morning, sir.
Thank you, sir. Presenter, thank you so much.
All right, until tomorrow when the program returns, remember there is a repeat at 10 p.m. through 11 p.m. tonight on Glow 99.1 FM. Remember, the health is worth, and I did say earlier that make sure you're part of the scheme. Make sure you join anyone that suits you. And he did give us the numbers to call, and I'll reiterate those numbers again. 0201
0201
700
700
4601
4601
or 0201
0201
700
700
4602
4602.
Those are the oranges line that you can put a call across to, or you visit their office just beside the government house office. Yes, the government office right here around Alagbaka there. It's not so far, so that's how much we can take. A very big thank you to you, our esteemed listener. Thank you for dropping the comment on our Facebook page. A very big thank you to executive producer Dr. Ezekiel Akon. Then of course, on behalf of the entire production crew, my name is Comfort Omolafe. Thank you for listening.
My name is Mike Alim Obafemi. Many thanks.